You have been the single greatest threat to my family in the entire world. You are the reason I stay up at night. When I am drowning, and you insist that I pay before you will save me, that is immoral, sir. You came for my wife. I will not forgive. I will not forget.
Wow. Town hall train wreck. Congressman Tom MacArthur took a 5-hour beating last night as angry constituents grilled the New Jersey Republican for effectively saving the House GOP's effort to repeal and replace Obamacare with his namesake amendment. Meanwhile, health insurer Aetna rubbing salt in the wound yesterday, announcing it's going to exit the 2018 Obamacare individual insurance market in the 2 remaining states where it had offered the plans. Here now to discuss all this, Washington Examiner chief political correspondent, Fox News contributor Byron York is back, Washington Free Beacon staff writer Elizabeth Harrington is back, and former G.W. Bush policy advisor Michael Barnes. Good to see you all. Byron, you know, when I first saw these town halls, which are focused on Republicans, rather than the town halls of 2010, I thought, yeah, maybe it's staged because, you know, they're all holding the same kind of cards. They look like more like activists than the 2010 Tea Partiers, who looked more like folks who'd never been in a activist, didn't have an activist bone in their body. But that particular thing that we just saw looked very real to me. Did it not to you?
Absolutely. Look, I think we have to take these town halls as an expression of real sentiment in the members' districts. I mean, this one, I think you do have to give MacArthur credit for staying there for 5 hours, which is, I mean, it's a show of good faith on his part. But, I mean, these people, I think, were quite genuine. I mean, look, if they were outside agitators paid, somebody had to pay them overtime to stay for 5 hours. So I think it's very clear. And in 2010, you had intense feeling against, on the Republican side, against Obamacare. Now you have intense feeling on the Democratic side. They can both be entirely genuine statements of the feelings of part of the electorate.
Right. But, Michael, meanwhile, Aetna is leaving for a reason. Aetna is going to lose $200 million this year. Aetna lost $700 million in the previous years because of Obamacare. There are good market reasons, and the only alternative is socialized medicine. I mean, this public-private partnership of Obamacare doesn't work.
David, I disagree wholeheartedly. I think that big insurance has brilliantly manipulated both politics and PR to make people believe that these exchanges are failing. The reality is that the Republican health care bill could have implemented some basic reforms to the Affordable Care Act that included meaningful insurance reforms that would have stabilized the exchange markets, not for the big Aetnas, because they're not going to be able to thrive in this market, but the smaller nonprofit companies and the smaller for-profit companies can, with some changes that are already in this bill. But they didn't have to go and give away the insurance industry everything that they wanted, and that's actually what the MacArthur bill did.
Here is the problem. It's fundamental. The problem with insurance, and frankly, I don't think insurance is the solution to everything. I think sometimes you have bad health care with insurance. I think good health care is the key. But the main thing is you're forcing what Obamacare and what the GOP bill does to a certain extent is force companies to do what is against their own best interest. And I'm an old Milton Friedman kind of economist. I believe that the market works, and you can only go against the market at your detriment. It's going to hurt you. So they're trying to force a round peg into a square hole, and it's not working.
Right, and so that's, again, the problem with this insurance and talking about covering pre-existing conditions. It doesn't make a whole lot of sense for the insurance company, and it's not really how insurance works. So when you're talking about how to reform this, at least the Republican bill gives a little bit more options. I mean, when you're talking about these exchanges where Aetna's leaving, you've had all of these insurers leave, where's the choice for these guys that are so upset at the Republicans who are trying to fix it or roll back the bad parts of Obamacare? Where do they go now when they have to enter the exchange and they have only one option and soon no options?
I hear you.
So it's not an easy fix.
But Byron, hold on a second, because Byron, what I'm thinking, because again, I've got this free market perspective. Forgive me, but that's what I have. That's in my bones. I think that eventually, unless you get back to market principles, where the healthcare system in this country is motivated by market principles rather than government mandates, you're going to have a problem. But now it has GOP stamped on it, assuming that the Senate passes this bill.
In the real world of today, though, Obamacare was created to be very hard to undo. I mean, Democrats knew they were passing it on a party line vote. It was, I mean, we've never had an entitlement that passes into law on a party line vote like this, and they knew Republicans would come after it, and they made it very difficult. And what you have seen in the House, and you'll see more of it in the Senate, is Republican lawmakers who are very reluctant to cast a vote undoing even part of Obamacare. I think nobody pretends that this is a full repeal of Obamacare, and it is so difficult because of those things like age 26, pre-existing conditions.
Let's get back to the
okay, Michael,
when you pay for something, you
my
expect
producers
to get something.
are giving me a wrap right now, but Michael, because you're so anxious to get it in, do it in 15 seconds. Go ahead.
Free market. You buy insurance, you need to get something for it. That means coverage for the things that you don't expect, things that you don't expect to happen to you. That's why insurance is there, and that's why you buy it.
A good nutshell description. Thank you very much, gang. I appreciate you all being here. Meanwhile, major averages